When we get donations of vaccinations that are almost expiring, honestly, we look desperate to receive those vaccinations, and therefore we are appealing to the government to liaise with the donors, whether America, Britain, wherever they are coming from, so that we are given a period of at least 2 months, so that we start getting ready. They come to the port or they come to the airport, and immediately systems are put where members, communities benefit from these vaccines. Otherwise, when they come and they are about to expire, it becomes big national issues that we have received vaccinations and yet maybe just half or less is used because they are in the store, because again they cannot, the government Ministry of Health cannot give expired vaccinations. So government, we are appealing that we put systems to ensure we don't become a dumping ground for vaccines.
CREED takes this opportunity to appreciate the President of the Republic of Kenya through the Minister of Health for his commitment to set up vaccine manufacturing in Kenya. This is a bold step in reducing inequitable distribution of vaccines and improving access to life-saving vaccines for Kenyans. COVID-19 is taking its toll on Africa, including Kenya. Despite rapid response to control movements of peoples and goods and encourage social distancing, the pandemic is inevitably spreading across the continent, albeit with a significant variation in number of cases per country. Civil societies and communities in health, research and development appreciate the government's role in responding to COVID-19 situation in the country, including the availability of vaccines and provision of PPEs to the healthcare workers. We also appreciate the laying of the foundation for local vaccine manufacturing by setting up systems and structures, for example, allocating resources and the establishment of the Kenya Biovax Institute Board. We also appreciate Kenya's investments of the average equivalent of 0.8% of GDP to research and development. However, civil societies and communities have been left out in the Biovax Institute Board. We are therefore calling onto the government to include civil society and communities in the new Kenya Biovax Institute Board through the engagement of CREED in the board and other civil society networks. Government to support regulatory harmonization through adequate support to the Pharmacy and Poisons Board to attain the WHO maturity level of 3 to allow Kenya to export the manufactured vaccines.
But in terms of the technical persons, the scientists, we do have enough scientists in the country that would be able to drive this agenda to the point that we would want. Of course, we start small and we grow it to a point that we can be able to supply beyond these borders. And we are all aware that some of the vaccines that we've received, not only in Kenya but also in Africa, have arrived when the time period is very short. As we speak, there has been a communique that has been sent through the African Union that has asked and is pushing for the quality of vaccines that we are receiving in Africa today. But I think as a country, again, we should be moving away from donations to using the mechanisms that are already there. COVAX has been doing a great job, but we all know that because of the way high-income countries went ahead of the queue, COVAX has gone behind. So we need to use mechanisms like COVAX, and the African Vaccine Acquisition Task AVAT to be able to acquire more vaccines for Africans that are able also to keep to our environmental status and our health systems that will reach the people when they're still potent.
In the whole process, one of the key roles of the community is to prepare their constituencies, is to prepare community members by giving adequate and accurate information on what all the vaccine is about, the issues around safety of the vaccine and the uptake, including even time frame. For example, we see we are struggling with the uptake of COVID vaccine. The vaccines are there, but the uptake is low. Why? Because community were not well prepared. Some of them do not have adequate information about it, so there's a lot of myth and misconception around this, which must be addressed. Another issue